Hello and welcome to our ultrasound review session. This is part one of two 1-hour sessions. A little background on myself. My name is Tamra. I graduated from Grand Valley 6 months ago and I currently work at the hospital. I see that we have lots of PTAs in the crowd and that's awesome, and a few PTs. Thank you for coming, even though it was optional. Our schedule of events is on your handout that you have received when you walked in. The first thing that we are going to do is kind of review the key points to the handout that you received previous to this session. After that, I'll give you guys a short demonstration, and then we'll do some small group work where you will actually perform the ultrasound treatment on each other, and that will be followed by a skills check. We want to make sure we're all on the same page with our competency in this area. Without further ado, we'll get into the PowerPoint now. Our first slide talks about indications for ultrasound. Can I get some people to throw out some ideas of why we would do ultrasound?
Pain, inflammation, arthritis.
Absolutely, those are three great ones. There's also contractures or subacute trauma. If you want to have some scar tissue you want to break up, ultrasound applies some deep heat, can kind of calm down those areas. But you guys got the big ones, so great job. Now, contraindications. Can we have a few of those shout out?
Tumors. Near the heart.
Yes. Any others? Shout them out, don't be shy.
Infection sites.
Oh yes, perfect, those are great. So, our general heat contraindications, we're aware of those. Also, any sort of vascular insufficiency or impaired sensation, not a good idea to do ultrasound in that area. Again, near the heart or any of these other areas. Pacemakers, now it doesn't mean someone with a pacemaker can't have ultrasound applied to them, it just means it can't be over the pacemaker, so it can be at a more distal site there. Infections, obviously don't want to spread them. Skeletal immaturity, total hip, not a good idea. And any sort of unsafe equipment. So if your ultrasound head isn't working correctly or there's a hot spot, it's a good idea to try to get that replaced. So what settings do we use? So PTs will write down the settings in their plan of care and PTAs will carry it out. But if you get a patient who asks you a question about this, we all need to be on the same page and understand why we're choosing the settings that we are choosing. So generally, deeper structures are 1 megahertz, and more superficial structures will be 3 megahertz. So, intensity and duration. Intensity is mostly based on patient tolerance, okay? So there's not a real right or wrong, but 0.5 watts per centimeter squared to 2 is the general range we want to be in. So as PTAs, if the PT put down 2 and your patient sort of grimacing, they're in pain, they're jumping, it's okay to turn it down to a lower intensity and see how they do. But we need to make sure we report that back to the PT and tell them of that change so that they can modify their plan of care. All right, now, and again, duration 5 to 10 minutes, standard. Okay, treatment area. 1.5 to 2 times the sound of the ultrasound head, okay? So we have our ultrasound head here. We're only going about 1.5 to 2 times this, okay? We're not going to the car wash here, okay? Small circles, okay? And continuous movement is key, all right? If we stay in one spot too long, your patient might feel a zap and it'll make them uncomfortable, so we do not want to do that. And again, here are our methods, the gels, water, gel pad, and again, the PT should specify what they want. Methods for delivery, we're mostly going to do the continuous, okay? We want the thermal effects. We want the deep heat to the area to calm down the tissue so that we can eventually get some stretching or mobilization to achieve some functional goals. The pulse doesn't have thermal effects, so we are going to not want that. After application, again, like I just said, these thermal effects only last for about 2 minutes. So you want to make the most of those 2 minutes. You want to stretch, mobilize, get some extensibility out of that tight tissue. So what does the research say? It is very conflicting. Some studies say it works, some studies say it doesn't work. So that is just something to keep in mind when we are prescribing ultrasound or doing ultrasound on people. All right, we're going to move into the demonstration portion. Can I get a volunteer, please?
Me.
All right, come please. Hop right up. We're going to do your anterior talofibular ligament, so please put it on the pillowcase here. We'll roll up your pants and put a towel around. All right, go ahead and relax that leg down. Okay, and come gather around because I'm going to show you guys how to use your new ultrasound machine. All right, to turn this baby on, we're going to, the power button's back here. All right, and then it'll give you a list of different features. We're going to click on ultrasound. Okay, so edit right here. We want to edit the parameters. Push this button. All right, frequency right now is at 1 megahertz. We want to change that. The anterior talofibular ligament is pretty superficial, so we're going to change that to 3. Our duty cycle is 100%. We want it continuous for thermal effects, so that's okay. Now our intensity right now is at 0, so to adjust intensity we're going to turn this knob here. And again, this is on patient tolerance, so we're going to try a 1 to start. Anywhere between 0.5 to 2 is okay. Treatment time, we're going to adjust that to 8 minutes. And we're ready to go. Now we're going to apply the gel to the area. A decent amount, but not too much. And then I'm going to place the ultrasound head on the area and press start. So, small little circles. Does anyone remember how many times the size of the ultrasound head?
1.5 to 2.
Exactly. In very small circles. Okay, keep it moving. We're kind of close to a bone here at the lateral malleolus. We want to steer clear of that and make sure we're just getting on that ligament. Any questions?
When's lunch?
You can refer to your schedule.
What's the green light?
It means it's on. Okay, now we're going to break up into small groups. I've pre-selected your groups. They're on the board here. Trying to mix and match experience levels, PTAs, PTs, trying to make the most of a new experience. And when you're ready, please raise your hand and we'll come and check you off. Or if you have any questions, feel free to raise your hand and I'll be over to help you. Great.
We're ready. I think we're ready.
All right. What are your guys' names?
My name's Kayla. I'm a brand new PTA. Just started here yesterday, and I'm really excited.
Great. And you're going to be performing the skills check. What's your name?
My name's Rhonda. I don't need here this skills check. I've been doing this for 28 years. But I don't want to lose my job because I got to feed my 17 cats. So I'm going to do it anyway.
All right, Rhonda. Thanks for having a good attitude.
Yeah, no
You can
problem.
begin.
All right, well, I'm going to turn this thing on. These dang newfangled machines. Where's the old one?
The old one's dysfunctional. The ultrasound head had a hot spot, so we're replacing that one.
Oh,
Upgrading
well,
it, yeah.
I don't like these new ones. Okay. I think we're doing, yeah, ultrasound here. Edit, 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 edit. And we're going to be doing this here, patella tendon. And I'm going to do 3 because I think it's pretty superficial.
Very good.
All right. And what else do you want from me?
How about the intensity? What are you going to choose?
How tough are you? Okay, we'll do low. We'll do it real low. How about like 1 W/CM2. Right? Yeah. Okay.
Okay.
And then it's already on 100. I think that's probably right.
Okay.
And I know we got to do 8 minutes to get paid or something, so I'm going to do 8. That's what I've been taught, so that's what I'm going to do. Okay. In here. Make sure it's good and gelled.
Nice work.
And I'm going to take this here. put it on there. And where's start? Here. Oh, the green light turned on. I think that means it's good to go. And I'm gonna make sure there's lots of gel under here underneath this head. And I'm just gonna keep moving it around in little baby circles.
Alright. Okay, Rhonda, can you tell me a scenario where you would stop ultrasound?
Well, I mean, if she was gonna kick me in the face, she was probably in a lot of pain, I'd probably stop.
Okay.
I don't want to get kicked in the face.
Okay. And what is a reason why you would do it on the patellar tendon?
Well, you're a runner, aren't you? I think she's having a lot of pain, that patellofemoral pain.
Okay. Very good.
Can
You
I
don't
be
have to
done
keep
now?
going. Yep, you can go ahead and stop. You passed.
I passed?
Congratulations.
Well, hallelujah!
Yep. So I'm going to give that to your supervisor to document your competency.
Well, thank you very much.